Hello, thank you so much for joining us on Zoom tonight for our Ultherapy event. We appreciate everybody logging in. This is a great presentation. Jen Heck does a phenomenal job at explaining all the details of Ultherapy. During the presentation, if you look at the bottom of your screen, there is a chat and a Q&A button. Please do not hesitate to ask questions. I'll be in the back answering as many questions as I can. If I don't get to your question live, I'll be back out at the end and Jen and I will go over any questions. At the end, we'll also introduce the raffle that we have tonight. It's a great raffle, you don't want to miss that. And of course, our event promotion. So we will get started. Hopefully our PowerPoint will work here. If not, I'll get on it. But Jen will get started with the presentation.
Awesome. Thank you. Welcome. And I appreciate your time to join us this evening. So what we'll do is about 20 minutes and we're going to go over what the results look like, what it is, how the science works. So rest assured, I'll be cognizant of your time. I appreciate it, Laura, and I know you guys are all busy and I appreciate you logging on this evening. So let's first go over sort of the general information of Ultherapy. My name is Jennifer Heck, like we mentioned. I'm the clinical director of Ultherapy. We've actually been providing Ultherapy services here for nearly 5 years, actually this summer. And so myself and my team of other nurses and estheticians provide this service that we are still excited about to this day, because now we have hundreds and hundreds of clients who have had wonderful and amazing results over time. So I'll explain to you why. When we think about Ultherapy, first and foremost, the basis of it is that it's the #1 non-surgical device for skin lifting and tightening of the face, neck, and chest. So as we enter our late 30s to 40s, we generally start to see a little bit of our signs of aging as we lose that collagen and elastin. Usually we lose that about 1% in our 20s per year. And then unfortunately in our 40s and 50s and then into our 60s, usually the late 40s, we start to see those changes in our jowl area where we start to pocket a little more tissue around the corners of our mouth. Late 40s, early 50s, you know, we see those dreaded the neck changes that many of us, no, believe me, I don't want them either. So that's really common, and it's science, nothing you're doing, but it goes to the root of what this slide's looking at, right? So collagen and elastin. So that first illustration there in the middle is trying to give you an idea of what the lattice work looks like. So if you think about your layers of your skin as a mattress, the top of the mattress, the things that help the surface of your skin are things like facials, Botox, laser therapy, microneedling, things the estheticians and the laser providers do, and as well as our physician and nurse injectors. That slide's trying to show you that collagen and elastin. So think about it like a lattice work. And as we age, on the right-hand side is trying to show you that, of course, we get a loosening of that. That shows our signs of aging. And it's the science. It's the collagen and elastin that, unfortunately, is sort of withering away, for lack of a better word. And so that's where Ultherapy is really targeting. What we see as we age, we see a decline in collagen production. Our collagen fibers get weaker. And that's how we lose our elasticity. So then that manifests in things that we can help with Ultherapy, lines and wrinkles, the cheek sort of losing volume and dropping, eye hooding, you know, when you start to feel like the hood of your eye starts to go over your lashes, sagging neck, I hate that word, right? Sagging neck, and jowls. So that's that area on the corners of your mouth as our cheeks start to lose volume and we start to get a little pocket here. So those are the clinical indications of things that we would use Ultherapy for. So when we talk about building collagen, Ultherapy is actually an FDA-cleared device. As I mentioned, the skin on your face, your neck, and your chest. So that first photo here, what I want you to sort of take away from that part of the slide is that lattice work at the bottom of that first photo is trying to illustrate for you what it looks like when it's healthy and tight. So as we age, that's what we're targeting with Ultherapy. And a client is going to be laying down. You're seeing that transducer there. You're actually laying back like in a facial position. I'll show you a video of a client that's actually getting treatment here in the subsequent slides. And we use an ultrasound guided energy to trigger your body's natural response to help rebuild that collagen and elastin. So over 3 to 6 months, what we're trying to show you there in that bottom slide is that lattice work appears tighter and more firm. That's the whole goal of Ultherapy. So what we like to tell you, so sometimes people have heard of it by name, and if you haven't, sometimes people will call our office and just want to know what we offer for loose skin on the face and neck. So we here at CAPS would know that we would perhaps have you with an Ultherapy provider to give you the education on that. But I want to let you know too, just because we love it, I want to let you know it has won multiple national awards year after year. New Beauty Magazine ranks all non-surgical devices for us, and it's won 7 years in a row of #1 lifting and tightening device. So wanted to let you know it's not just us that love it, it gets national beauty awards as well. So when we lay you down in sort of like a facial or a laser position, we're actually able to visualize the layers of your skin. Very exciting for us as nurses and estheticians that we can actually see the layers in which we're going to target with that micro-focused ultrasound energy. So exciting for us, just let you know that it actually keeps you safe because we can exactly see where we're going to put those TCPs, and I'm going to talk about thermocoagulation points, because we need these heat points down at that collagen and elastin layer strategically so we're going to look at those layers, we can read where we're going, because that starts a cascade of events where your body and your collagen layers, it starts to simulate, for lack of a better word, in a controlled way, starts a recollagenesis because we've traumatized them in a controlled way, but in that causes the lifting and tightening over 3 to 6 months because we're starting a cellular response. So who says Ultherapy boosts your collagen? And of course, it's the science. So you see now we're doing ultrasound guided thermocoagulation or ultrasound guided energy right at the points where we want to deliver it so we can stimulate that collagen and elastin layer. I love this illustration because the big, and when we meet you in person, we're usually pointing at it and showing it to you in your consultation, which, by the way, are always complimentary. So even after this presentation and you want to see if you're individually going to be the right client for this, we, of course, will see you complimentary. We always say, give us a half hour, 45 minutes of your time. We can actually do this at Easton. We can actually do this in Upper Arlington, either location now. So rest assured, individually still, you're going to get an assessment from one of us. In that illustration, what I like on the far right of it, you're actually seeing sort of like a gold dot. And so those dots are trying to show you that's the deeper layers that we're delivering energy. The biggest difference that Ultherapy is, a lot of clients want to know, is there downtime with Ultherapy? And there really isn't. In a couple slides forward, we'll talk about, what to expect and what you'll look like. But you have to remember, because if you think about your skin as a layer, the top layer, remember, is facials, Botox, laser, things that microneedling on the top. We're going way underneath. So when you leave here, we've actually delivered the energy and we've bypassed the top of the skin. So you actually don't have downtime. You don't leave here looking like you had something done. We actually put a relaxing towel on you, some nectar, some soothing, and then cover you up with some nice tinted moisturizer. So you really don't look like you've had anything done. So that's the big difference, right? So it's not if you want to look, it's not necessarily for if you want to resurface or if you have brown spots, right? This device is not the one for you. This is for skin lifting and tightening because you're going below the surface of the skin. I love this visual. What this is showing you close up are those TCPs, thermocoagulation points, that we're delivering with the transducer as we lay it on the skin. So this is trying to show you as we lay it on the skin, those little heat points going down right at the layers we need to deliver them. And then the bottom image gives you this, because when we're doing it and we're delivering these points, you don't physically see them on the surface of your skin. But I love this image because even me as the nurse and as the girls are delivering your treatments, it helps you understand we're actually laying hundreds to sometimes over 1,000 of these heat points all along the facial mapping. And that's all determined prior. You're going to know in your consultation what areas, and is your problem areas. We'll let you know if this is the right device for you. And then we layer these thermocoagulation points over 2 different times during your treatment. So in that respect, it does take us some time. So during your Ultherapy treatment, it can take sometimes an hour and a half up to 3 hours. When we know your individual plan, we will also then let you know how much time you need with us here in the office. During your consultation, these are some great examples, those areas highlighted in yellow, of some of the treatment options you can choose. Some clients come in just for the neck. In general, that might be clients in their 30s, sometimes 40s, and maybe you haven't started to see changes in the mid face and the lower face. Sometimes we just do the neck. Generally, we're doing at least mid-lower face to neck, meaning the areas under the eyes, traveling all the way down to your clavicle. And then of course you can do anything from the full face, because remember, it's FDA cleared from the top of the forehead down to the clavicles, and then can also do the chest, also known as the décolleté in Ultherapy world. So when we do your consultation, figure out your problem areas and your goals. We'll determine the right path for you. The length of time and how much it costs is dependent on the amount of areas that you cover. So that is always part of your consultation as well. So let's talk about, the results. I think that's always the fun part. So when we do your treatment, it's not an immediate result, because as we talked about, you're not resurfacing the top, you're going underneath, you're stimulating. So generally those results are slow and gradual over 3 to 6 months. So we'll take your photo at the beginning of treatment or at your consultation, and then generally touch base with you at about 6 months. A lot of our clients are here doing facials, lasers, and it's sort of a marriage between a lot of different departments. So we always catch you if you want to do photos. And generally saying, though, I always say plan ahead. If there's some big event or some big life milestone you're coming up on, plan ahead if you need lifting and tightening. It definitely doesn't work in a week or two. So it's one of those things that you do plan ahead for. Generally speaking, the earliest we can ever do Ultherapy is every 6 months. Most clients do it once every 1 to 2 years. And you have to remember, even though we're stimulating and sort of invigorating that collagen and elastin layer, we still continue to age, unfortunately. I know myself, I've had 2 Ultherapy treatments. Many of us providers and our clients that love it, they generally come once every year or 2. And I say, if you're layering in your facials and you're doing some lasers here and there, it's just such a great comprehensive plan. But you can do it every 1 to 2 years. I wish it was a one and done, believe me. But like many things here at CAPS and things related to skin, it's going to be a maintenance procedure over time, but it's not a series. It's a one, and then you wait and you do it again in a year or 2. Okay, so what we're going to do, and that just sort of gives you another little illustration that's sort of giving you the idea. Of course, it does the forehead, helps with hooding of your eyelids, helps around the jowls, the neck, and the chest. So let's get to the fun part. So we're going to start to go over some real results. So this client, I laugh because I know her well. I actually just did her second treatment about 3 weeks ago. And she had done this treatment, it was about 2 to 3 years ago. She was 54 at the time. And really primarily it was those changes right under her chin in the jowl area. When she came back for her follow-up, we had a chuckle. She's like, I just don't know if this thing worked. And I think when it's slow and gradual, it's hard for you to tell at home. So that's why we do photos. We're always happy to look at them with you. But I think we can all agree the area around the lips and the changes in her neck were really beautiful. And so she does facials in between and maintains her skin as well. This client was also mid-50s when we did her treatment. This result around 6 months later is just a really beautiful, nice, natural result, especially around that jowl area. And I always say, like if somebody wants a facelift and they want to be tight and taut, Ultherapy is not going to make it magically as tight as a surgery. So I don't want people to think it replaces a surgery, but this can maybe help illustrate some of those nice, beautiful results that you get, which is really phenomenal. I feel like for a mid-50s year old client, she was super happy and still is with Ultherapy to this day. The side view is actually really impressive, I feel, as well. So sort of gives you an idea of how that jowl area was lifted, her neck is improved. So we were super excited about that. These are really some good examples too, and it doesn't matter. You can do it in your 30s, 40s, and 50s. I would say very rare. I don't think we really do anyone in their 20s for Ultherapy. I think you can do some other things in the esthetician department for a much younger client. But this is a great illustration of clients with some small neck changes, sometimes those minor changes. A lot of people now are looking down on their phones and we call it tech neck. And sometimes they're just wanting to tidy up or clean up that area under the chin and those necklines. This is a really nice option for some of those problem areas. Here, these are more illustrations of clients in their 50s and 60s. So a lot of it depends on what you want. clients for us can't expect a surgery result, but we can get some really nice outcomes. So you're going to see improvement. It's just in your consultation. It's really important for us and all the providers to really understand what it is you're looking for. Generally speaking, you know, of course, and this is a lot what we tell our clients, we do Ultherapy every year or two until you're not happy or you're at the age where you want a surgical result. That may never come, and that's okay. But Ultherapy can help maintain and keep that skin lifted and tightened. But we'll always guide you on if, you know, we have consults sometimes where maybe your laxity is more severe, and we're very honest with you. So if we think you're too advanced for Ultherapy, we'll let you know that as well. And of course, you can always get a complimentary consultation with our surgeons if our device is not the right option for you. Ultherapy is something we do quite a bit as well for the décolleté and the chest area. As you age, and if you're a side sleeper, you know, we all sort of get a lot of clients refer to it as like river marks, and it goes down right in between the chest and the chest line. So we can absolutely apply this technology to that area as well. Here's a few great photos, sort of gives you an example over that 3 to 6 months, how we can get improvement on the chest line. These are great areas for Ultherapy. Here's where I wanted to just give you an idea of a client laying down in a real natural position. She was receiving the treatment from me, and what you're going to notice here, though, even though we're delivering heat points, I want to let you know that we do give you medical grade numbing cream. Obviously, I was actually really doing the treatment. You know, you're getting heat points, but we give you medical grade numbing cream. If any of you have ever had Pronox, we use it in a lot of different departments here at CAPS. It's sort of like a laughing gas that you would get at the dentist. That's another strategy for discomfort. We always give 800 of Motrin prior to the procedure. So we have good strategies to help keep you comfortable, because remember, we have to use energy to deliver those heat points. So just rest assured, because we are a medical practice, we have strategies to help keep you comfortable that a lot of other practices and med spas can't have, because they're not run by board certified surgeons. So when we talk about the treatment, just know, as I mentioned, you're going to always have a complimentary consultation so we can individually determine, A, is this the right device for you, if it's going to meet your goals, and if it is, we then let you know where we're going to treat you, how much it would be. We always remind you what we're going to do for your comfort plan, which includes Motrin, numbing cream, Pronox, and then when you leave, you always have your follow-up. When you leave treatment, a lot of clients always need to schedule around their busy lives, trips, work, family life. We get it. Because we're going down beyond the top layer of your skin, remember, you're not going to leave here looking like you did anything. So the beautiful thing is you really have no restrictions. You don't have to worry about, well, we're always going to say you need to be out of the sun, but it's not like a laser or like a microneedling kind of thing. So you can use your own products. We have a few simple products you use after Ultherapy, including like a neck complex and some nectar that helps clear cellular debris as you're healing. But in general, you can go about your way, you know, you can go back to work, you can go out that evening. It's not something where you can't be going about your activities of daily life. You know, usually sometimes the second pass of Ultherapy can make you have a little bit of, like, if any of you Botox and you have those little bumps for, you know, 20, 30 minutes, you can get those with Ultherapy too, but they resolve. Sometimes maybe worst scenario a couple days. But again, you can wear your makeup over them because you're not treating the top layer of their skin, you're going down below. And then it's like a waiting game, 3 to 6 months. The biggest thing after Ultherapy, we actually want the inflammation to happen. We always tell you, and you would get post-treatment instructions, we actually don't want you taking Aleve, ibuprofen, Motrin, things that block inflammation, just for that week or two after the procedure. So very easy, and we remind you of all that when you're here. So we're going to go over a few more results. I think this is a lot of what resonates with you at home when we can't do all this in person. You know, that area around the corners of the mouth. This client was also in the mid-50s when she did her treatment. I absolutely love this photo. I think it's very impactful on the improvement she got and that complex around the jowls and the neck. This is a win-win for anyone, right? This client, she did a full face, and this was a year later. What I think is really beautiful is the improvement on her chin, just very natural, and just helps to bring up that corners of the mouth area. Now, this client was in her late 40s, and honestly, she looked great. We were doing it mostly, she didn't like the little bit of changes she was seeing right under the chin. And much like the client I was telling you about earlier, she was like, gosh, I don't know if did this do a lot under my chin? But when we really lined up the photos, it was pretty impactful on that contour that we were able to get around her jawline. And I actually just redid her treatment probably about 6 months ago. This was probably about 2 years ago. And she to this day still really truly believes in the science of it. It's been very helpful for her skincare journey. This client was also late 40s, so you can really see a great lifting in that chin area and around her jowls. This client, what I liked about her is that, you know, she was in her she was maybe 52 at the time of this treatment, but it just sort of helped clean up these real subtle changes she had under the chin. She's a very thin lady, runs a lot, doesn't have a lot of body fat, but so she wasn't having a problem with fat, she's having a problem with that skin under the chin. So she was super happy about that. This is one of our clients. Hopefully it resonates with you at home. It's really hard to capture those chest lines on photos, so hopefully you can see it, but just a really nice change in the chest of the lines that were given this client, sort of like that was her area of concern. So we were excited to treat that as well. So hopefully that gives you a good idea of what the science is in a little short and abbreviated term. Rest assured, the most important thing is your individual assessment with any of us nurse providers and the estheticians that do Ultherapy. There's several of us, it's easy to schedule. So we will individually map out your cost and what your areas are once we meet you. And then what we're going to do now is Laura's going to tell you about the raffles that we're going to do, which is always fun because everybody loves to win. So we'll transition to Laura and then we'll wrap up.
Perfect. Thank you so much, Jen. I love those before and afters. I love it when we get to have actual CAPS patients right here in the office and you can see the real life before and afters. I think it just means so much more than kind of looking at
It's
it
fun for us too.
at a website. Those are fantastic. So thank you.
I want you guys to know truly at home, like us nurses and estheticians that, I mean, we get as excited about it as the, I mean, you know what I mean? Because there's nothing we want more than for you to be happy, honestly. Really. I mean, you know.
I love seeing it. And I've done these events so many times, and every time I get so excited about the pictures, like it's the first time I ever saw them. And thank you, Jen, for saving me on my little technical difficulties.
No
she
problem.
just rolled right through it.
Yeah,
It's great. But first, I want to talk about the raffles. So Skin Medica sponsored our event tonight, and they have provided a great event raffle. You don't have to do anything. If you're attending tonight, you are automatically entered, and I will go ahead and I will call the person tomorrow. Two things: we have the new Skin Medica neck correct cream. It's one of their newer products. It is absolutely perfect with Ultherapy. So we have the full size neck correct, and we also have the HA5, the hydrator, hyaluronic acid hydrator for the full face. So and also a set of travel products with that. It's over $300 package. So one of you will win, and I will be in touch tomorrow with the winner. Lastly, I also want to talk about the event promotion. So we always try to put together a great promotion for any of our Zoom events, but this one's really good. So because you attended, anyone who signed up for the event, a few things. One is the no cost consultation. So absolutely, we want you to call the office, 614-246-6900, if any of you didn't have that. And we'll get you scheduled at either location. We can do the Eastern office or the Upper Arlington office. And first we'll get you scheduled for the consult. If you decide to go ahead with the procedure, you will get, if you schedule your face and your neck, you will get the free chest. That's a $1,400 savings. It is a great promotion. I'm so excited we were able to do it for this. So automatically too, you don't have to do anything for it. You were registered, it's in your account. So if you come in and get your consultation, we'll talk to you about it then. I am gonna stop the screen share here so that we can go over some of these questions. You guys had great questions coming in. Thank you, thank you. I got to some of them, but I have the neck correct cream here. So I got to some of them, but there's some more I wanted to elaborate on. And some of these Jen had touched on, but I just want to reiterate them because they came through with a couple of people.
Sure.
One of them, this came a couple times. How often do I need to get the Ultherapy treatment?
Yeah, sorry. So minimum, some clients actually are sort of obsessed with it. We've had a few clients that actually want to come sooner than 6 months, but that is sort of our clinical threshold. You can't do it any sooner than 6 months. However, most clients do it once every year or two. Perfect. So it's a one-time treatment, I'd say every year or two. And a lot of that I say depends. It depends on, okay, are you going in for facials? Are you doing microneedles? Are you getting lasers? You know, yes, do we have some clients that Ultherapy is their standalone and that's what they use? That's fine, but sometimes we can space that out a little longer if you're doing other things.
Right.
You know?
This is a good one. I hadn't thought of this. How long is the actual Ultherapy appointment? So how long does the treatment take once I come in that day?
Yeah, I would say in general, so we'll map that out for you in your consultation, because we, just as much as you, we need to know how long to schedule, and that's determined by what all we're gonna cover. If we do full face, neck, and chest, I'll be honest, I would say we're gonna definitely book that 2.5, 3 hours. By the time we numb you, get you comfy, lay you back, take a restroom break, mark you, do all your stuff. So it's, you know, one of those things, you're here with us for a while, so we plan it accordingly.
Perfect. Oh, here's another good one. Can I have Ultherapy if I had a facelift 8 years ago?
We do many clients that are post-surgical,
Mhm.
and a lot of times clients that have had facelifts, and I would say we wait a minimum of, generally, I would say minimum of a year post facelift to add any energy, because really shouldn't really maybe need it.
Right,
yet.
right.
But some clients really want to stimulate that collagen, and they don't want to lose their results,
Mhm,
because you still
exactly,
continue to
right.
age no matter what you do. So 8 years, absolutely, you're well out of the woods. So we always have that discussion for you, if, you know, with you, if you've had a surgery of any kind, actually anywhere on face, neck, and chest. Yeah.
Perfect. Here was one that came in, and I actually want to elaborate it on a little bit, but do I need to wait to get Botox before or after? But I also want to ask you about filler.
Yeah.
What about filler before or after? How long do they wait?
Yeah, I say a good rule of thumb, and this is almost true, don't you think, Laura, for almost any department we do here, is generally 2 weeks.
Right.
You know,
Yeah.
but like, so say and this happens a lot, we're starting to see clients that come from hours away.
Mhm.
We will give you individually. So say I'm going to do Ultherapy and that client needs Botox. Well, I would do the Ultherapy first, and then they could
Yep.
go do their Botox with the nurse or the physician. And that's totally fine. It's a lot of how we coordinate it. So we're happy to do that. If a client has filler recently, or even if it's months past, because as you know, most of your fillers are going to last a year plus, we are able to see that on ultrasound. We can avoid it, and we always discuss that with you. And a lot of Ultherapy mapping isn't directly over where most of the fillers go,
Mhm.
ironically. So it ends up working out, but we definitely discuss that as well.
Perfect. And last one, and again, if there's any that I didn't get to that were being delivered after I came out, I will get to them. I'll get the information from Zoom, and I will get back to you on email with that. But this is kind of another one I wanted to add on to. Can I get a facial the week after my Ultherapy? So somebody is scheduled for Ultherapy and wants to schedule a facial after. But then I also wanted to ask on lasers too. How long should I wait to get my laser after that?
Yeah, I would say facials, depending on what kind it is, because as you know,
Right.
here now, we've got so
So
many
many
different
options.
things. And so I would say, you know, a basic exfoliation or like a diamond glow after an Ultherapy is fine, because remember, I'm not doing anything to the top layer of the skin. I would say you're going to wait a good 2 weeks for anything laser wise, BBL or halo around Ultherapy before or after. But I'd say, you know, nothing real ablative. I wouldn't do Ultherapy likewise before 2 weeks after someone did a halo or a BBL or a microneedling. But a basic facial or like a normal facial and like a mask and stuff, that's fine. You know, it's all about the depth of which we're innervating. So we'll definitely discuss that with you individually if that comes up.
And of course, we go over all of this in your consult. So please don't hesitate to call. I'm going to send a link to everybody who registered. I'll send a link to this recording. So if there's any parts of it that you want to see again, if you want to look at the before and afters, or if you want to send it to somebody that might be interested, I will get that link out tomorrow morning after I get it from Zoom. And any questions you have, please don't hesitate to email me. I think you all have my email, Hager, Columbus Plastic Surgery, but you can also reply to that email tomorrow once I get you the link. Thank you so much, Jen.
Thank you so
Great
much.
presentation. I love it. Thanks, everyone, and have a great night. Take care.
Thanks, Laura.